Now, how frequently these should be done, most recommendations currently are believing that this can be occurred once a year, and that's reasonable. Now, that may change with specific athletes in terms of, if they have an injury or if they have additional concerns, that they may want to touch base with their provider more frequently than that. But most athletes are training, good portions of the year at this point, and if they're doing okay and they're not having any new issues, then I don't think they probably need to see someone each quarter unless they have any questions or concerns. But I would also say that when they are being screened, they should make sure that their provider knows what sports they do plan on anticipating over those periods of time. For instance, our pre-participation exam for some sports may be slightly different based on those activities, and if they're in different sports throughout the year, that we may tailor that slightly to accommodate that.
During a typical preseason evaluation that you would do, what are some of the examples of red flags that you would pick up on during that evaluation that would indicate a player should temporarily or permanently be restricted from play?
Good question. Well, first I'll touch base on what the process is, and that'll give us a better understanding of what red flags we're looking for.
Okay.
First of all, there are some great published tools that are widely utilized that are obtainable over the internet. The ACSM, American College of Sports Medicine, AMSSM, and several other groups have come up with a consensus document that fits for history and physical evaluation of this type for multiple age groups. Some of the high schools have their own, the Ohio High School Athletic Association in our state has their own form that has been put together, and then each governing body sometimes have their own requirements as well. So you should look at who is actually requiring this and what information they need. But the history is probably one of the most important parts of the assessment. History in general, the athlete's history, have they had one red flag is if they've had any restrictions in the past for any reason. Another red flag is if they're having any problems with dizziness, chest pain, shortness of breath, any exertional type symptoms. And there should be any good history and physical should have some kind of cardiac screening list of questions, and the American Heart Association has included those in most of these standard documents and should be included in other ones if they choose to use other forms. The history alone will pick up most of the questions or concerns that we have in athletes. We've seen athletes that are still symptomatic from concussions from their previous season of football or the previous year of football, which would obviously be a concern. Physical can be important and can give us additional information. We do things like blood pressure screens, which is good to know, and there are certain parameters that if they are outside of those realms would be a red flag, at least for immediate participation. Visual screens, looking for any unusual, unpaired organs on the exam. Other opportunities, depending on the resources available, EKGs are done at some level. Some people have labs done, but there are one additional red flag would be a new heart murmur that's diagnosed on the exam, which could, again, limit to someone's participation. So the good news is that most people who have these pre-participation evaluations, only a small fraction, probably 5% or more, are even temporarily excluded. And then ultimately, I would say 1 to 2% at most are ultimately undergo some kind of permanent restrictions in their activity. So most of the things that we pick up are fairly minor or correctable, or with further investigation can be cleared and the athlete can progress back to their sport. But there are a few instances where we do pick up something that would change our recommendations for that participation.